Hello, good morning. My name is Jeanette Almonte. I'm the Director of Nursing for Oncology at Johns Hopkins Hospital. We recently reviewed your Glint survey results, and one of the most common themes was that communication seems to be missing, or there's a little bit of a disconnect when initiatives and education is rolled out. So to improve this, we decided to come up with something we're going to call HiFive Friday. And every Friday, we're going to come out with the 5 most pertinent topics or issues or educational rollouts that are pertinent for your roles. So the first one, we're actually going to have a recruiting event next Thursday from 4 p.m. to 7 p.m. here in the Weinberg lobby, and we will be offering tours. We're going to have light refreshments for our potential candidates, and we'll be offering on-the-spot job offers. So please, if you're interested in interviewing or being a part of that event, let your managers know. We would really like to have a few frontline staff workers come down and interview some of our potential candidates. This will be for both inpatient and outpatient nurses. The second is the basic cardiac monitoring training. I've spoken to many of you, and this has been, I guess, a question as to why our nurses don't have this monitor training during orientation. Well, that has changed. Now, all of our nurses will receive this training during their orientation, and we're also going to do catch-up for all the nurses that have not yet received it. And again, this is going to be for our basic cardiac monitoring, and you will receive more information from that from our CNS and nurse educator group. The third is our Pyxis machines. We are going to have our Pyxis machines changed. This is an entire JHH initiative. Our machines will be changed during the first week of August. We will have educational rollout. I think there's a few modules, about 4 or 5 modules that we must all complete prior to that time. We're going to assign them to everyone and we'll have more or less about a month to complete them. And yes, we are offering iTime for you guys to complete these modules. It takes about 2 hours worth of time. Your managers will have more details about that. The fourth is payroll. Please, the nursing business office has asked us to let you guys know that if you have questions regarding your payroll, you should reach out to your manager directly. Your manager will then escalate the issue or be able to provide understanding of any payroll issues. So please refrain from contacting the nursing business office directly and contact your managers. The fifth is an important one. It's about our blood administration documentation. We recently received a report stating that we were out of compliance regarding recording or documenting our vital signs transfusion 15 minutes, 10 to 20 minutes, after the transfusion has started, and within 1 hour post. There is a tip sheet that's going to be attached to this video, so please, it's very important that you review it. And just to reiterate, your pre-blood vitals need to be taken within 1 hour of the start of transfusion. Once the transfusion has started, we again have to take another set of vitals between the 10 and 20 minute mark. Remember, they have to be documented in Epic within that time frame. And last, once the transfusion is done, remember that we have to record it within 1 hour of completion. There is a tip sheet and attached, and there's also just a figure of what it should look like for a sample patient. We hope that this helps kind of close the gap with communication. We look forward to doing this every single Friday. You will see all of your nursing leadership take turns doing this, and I hope everyone has a wonderful weekend. Please, 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 if you have any feedback about these videos or if there's something that you would like to hear more of, please let us know. Thank you so much. Have a wonderful weekend.